class. Today we want to do eye swabbing. So when you want to do eye swabbing, you have to ensure that you prepare yourself for a sterile procedure, because it's a sterile procedure. And then we do eye swabbing. For example, if you look at the patient, if there is eye discharge or there is conjunctivitis, so you can do eye discharge. You can do eye swabbing. So you can just remove the discharge even from the eyes, but you have to ensure that you follow the procedure how we do it. So let's start as usual, hand washing. Okay. So this is the OST type, 1, 2, 1, 2, 1, 2. You have to be quick. Okay. So after you do that, you can dry your hands. Then you come to the patient as you're drying your hands. So good morning, Mr. Mulenga. I'm student number 2. I have come to do eye swabbing on you. May I please go ahead? I said yes. Okay. What about where you're sleeping? How is it? So you check where he's sleeping. Okay, where he's sleeping, it's okay. And then also look at the eyes so that you determine the number of swabs you're going to use when doing the swab. Okay. So I've assessed also the eyes and he has permitted me to go ahead. So you go and prepare the solution. In this case, we are using normal saline. So you go behind the trolley. Okay, so but in this case, there is no space. You just do it from here. But then the label has to be in your palm. Then you pour. So after that, you can get the incontinence sheet, which is this one. So then you place it on his chest to act as a bib. So you can put it there. Okay, so that this will act as a bib, so that you don't mess up the linen. Then since you are done with the preparation, you have to scrub. So scrubbing as usual, you stand in front of the tap like that. Then you go this way, that way. Then you get soap and do 1, 2, 3. Then you do 1, 2. Okay. Then you go up to the elbow. Then even this side, you go up to the elbow. Then you rinse 1, then 1. Then you can close with your elbow, then you hand dry. So when you come here, the same principle applies. Use all the corners. So you start from the fingertips, since you are gloving up. So you start like that. This is the first corner. So you do that in between fingers. Then you go up to here. So you hold, you go to the next corner. Then you go outside the palm like that. Then you go in between. Then you can go in a circular motion like that up to your elbow. Then the third corner, which is this one, you go to this other palm, fingertips first, in between your fingers there. Then it also ends up to here, this point here. Then fourth corner goes behind your palm like that, fingertips, so that it's easy for you to wear gloves. So you go round, all the way around, then up to there. So after that, you can fold this and throw into the basin. There's a basin there. Just bend a little bit and then throw. At this moment, you have to now don the gloves. So sterile gloves, the technique is you have to hold here. As you can see, you hold there. Then you slide in like this. Okay. So this part, if you can see, I'm holding this part, not here. You're not supposed to touch with your bare hands here. So just there. So even if you haven't put your gloves nicely there, just go ahead and don the other side. So you can go. Then how you go in, you slide in like this. Then don this side. Okay. So even this side the same. I'm not holding this other part now. I'm just holding here because this is gloved, sterile. Okay. So now I can put them correctly. So I can just follow the fingers the way they're supposed to be put here, because you didn't place them correctly. So you can continue now. Just pull the gloves like that. Okay. So even this side where you didn't don correctly, you can go and do this. Okay. So that each finger goes where it's supposed to be. Like that. Then you can pull. So after that, you can now prepare your swabs. So in this case, you're going to prepare even about 7 to 8 swabs. So you get one by one. You dip, discard, dip, there, one. So there are 3, and this is the 4th. Number 5. So we're using normal saline, so you're dipping these in normal saline. So there are 1, 2, 3, 4, 5, 6. So now this is 7, 8. So number 8, at least you can approximate to say you're okay now, you can go ahead. Then you get the drip, you unfold it from the sterile field. In this case, we just want to make it sterile there, so you can fold it and go. Okay, so you can go like that, so that this area is sterile, but don't cover the mouth, so you have to ensure that you just cover on the sides. Okay, so at this moment, you're going to do the swabbing. So you start, this hand will be picking, then this hand will be cleaning. So you get and drop. So you start with the furthest eye. In this case, it's this eye. So you're going to instruct the patient to close the eye. So Mr. Mlenga, close your eye. So Mr. Mlenga has closed the eye. So what you do is now, after he closes his eye, you're going to clean from the nasal-temporal direction. Meaning this is the nose, this is the temporal bone here. So you go nasal-temporal direction. Then with the eye closed, that's how you clean it first. So the eye is closed, so you clean nasal-temporal direction. So we call this part as palpebral fissure. Palpebral fissure, because the eye is closed. So you go nasal-temporal direction like this. One swab up to there. Then this swab has to be discarded into this receiver down there on the bottom shelf. You get another one, then you drop. Now, when you cleaned the first swab, the eye was closed. Now you have to ask Mr. Mulenga to open the eyes so that you clean the upper eyelid. Again, upper eyelid, nasotemporal direction like that. Okay, so this direction, nasotemporal. So upper eyelid like this. One swab, that's all you discard. Another swab, lower eyelid. Then you go nasotemporal direction just like that. Then you discard the swab. So another side now, you have done the furthest, you go to the nearest, you go. So if it drops, don't pick. So you go, you like that. Mr. Mlenga, close your eye. When it closes, nasotemporal direction, palpebral fissure cleaned. Then again you pick upper eyelid, nasotemporal direction. Then lower eyelid, nasotemporal direction. In a case whereby you had normal saline dripping this side, you can get dry gauze and clean. So you can just pass it on and then dry that area where you had normal saline dripping. Okay, so that's it. So at this moment, eye swabbing is done. So you can even now go on with your IEC. Mr. Mlenga, thank you very much. Was cleaning your eyes so that we prevent infection and so that your eyes are kept clean. Thank you very much for allowing me to do this procedure. So after you thank Mr. Mlenga, you now go ahead and talk to the in-charge. So the in-charge, you're going to tell the in-charge to say that eye swabbing has been done and documentation has been done on Mr. Mlenga. So that's what you do. Thereafter, you can remove the gloves and wash your hands. So, and washing, that's the last part you do. Okay? That. Thereafter, you can dry your hands. So at this moment, eye swabbing has been done, so you have to just keep doing it. It's a very simple procedure, even if it's a sterile procedure. So thank you very much and keep watching.